All right, so in this video, we're going to talk about the muscles for the hip and thigh. So the first big group of muscles that we have in the hip and thigh that we're going to talk about are the quadricep muscles. So they're located right here on the anterior side of the upper leg, right? So they're going to run from here to here. So there's 4 quadricep muscles, hence the name quadricep. So we're going to roll up the shorts just a little bit so that we can see. And we're going to tell him to make a muscle. Right? So you can see right here, so this kind of teardrop, big teardrop looking one right here, this is the vastus medialis, right? So it's gonna run from, it's called the linea aspera. So it's gonna run from like a little lip there on the femur. You can't feel that lip, it's there, right? So it's gonna run from that lip down to the top of the patella, relax, the top of the patella, right, through the quadricep tendon, and then it's all gonna come down to the tibial tuberosity here, so across the knee. So that's going to be where that runs. Now, all of the quadricep muscles are going to come to the top of the patella, down to the tibial tuberosity through the patellar tendon. I think the book that we use calls it the patellar ligament, right? Because technically it's bone to bone, but most clinicians are going to call it a tendon still. All right, so if you make some muscle again, so you can see this big one right here on the outside. So this is your vastus lateralis, right? So we have the vastus medialis, you have your vastus lateralis. That's the one here on the outside. So that one's gonna go from the lateral lip of linea aspera, as well as that greater trochanter, like the crest of the greater trochanter, come down, insert in the same spot. And then we have the big one here on kind of in the middle up here. So if I want that one to really pop, what I'm gonna do is have him do a little bit of a leg lift, keep it straight and hold it there. You can kind of see it a little bit right here. Now this is the one exception to the rule as far as the quadricep goes, and that actually crosses the hip joint. So it helps with that hip flexion, right? In addition to just doing the knee extension, which is what all the other quadricep muscles do. So if I want to feel the origin of that one, that's that AIIS, right? So the ASIS, remember, is the bump on the front. We go just below that. So now if I go back to that leg lift again and have him hold it there, I can follow that tendon up and kind of feel that where it terminates there into the AIIS. So relax. So then the fourth one, we don't palpate that one because it's deep. It sits underneath everything else. So that's the vastus intermedius, and it's kind of sitting underneath all the others. Still comes down to the same insertion. So that's all of those. So that's our anterior muscles. So the next we have the adductors. So the adductors are going to be what we would, lots of people would refer to, as your groin, right? So the big ones there, we're going to turn his leg out just a little bit. We're going to roll this up and switch sides, right? So one of the big ones there that we have is the gracilis. So the gracilis is going to come down about the seam of your pants. So it's kind of a strap type muscle that comes down the seam of your pants. And it's going to come around and it's going to attach at the pes anserinus. So we'll talk more about that as a landmark when we talk about the kind of knee joint. But it's gonna originate up high. It's gonna come down and insert into that pes anserinus. So it's just kind of a strap there. Now you also have your adductor magnus, which is gonna come down to the adductor tubercle, which is gonna be right here. So it's just, if you go to the condyle and just go above it, it's gonna attach right there. And then you have the longus and brevis, adductor longus and brevis, and those are also gonna be right here in this area. So it's all pretty straightforward. They're all just there on that medial side. All right, now next one we're gonna talk about is the sartorius. So it kind of does its own thing. It is the trivia question, is the longest muscle in the body. So that one's gonna start at the ASIS. So if we go back up here to that bump on the front, and it comes across, now it doesn't come across in a straight line, like it kind of loops over the top of that rectus femoris, right? We just talked about that one. So it comes across that rectus femoris, comes down, and it attaches at that pes anserinus, right? So we have 3 things that attach at that pes anserinus area. So this is the second one, right? We had the gracilis, and then we have the sartorius, so it's kind of running across this way. Next group that we're gonna look at is gonna be on the posterior side. So we're gonna have him roll over, right? So the first one, let's look at the hamstrings, right? So we have 3 hamstring muscles that are here on the posterior side. So if I wanna find those or have those pop out a little bit, we'll go back, we'll roll the shorts up just a little bit again, and I'm gonna kind of hug this foot and have him try to pull his foot up toward his butt, and you'll see those kind of come out. Now, it's easy to find them down here at the tendons, right? So I don't know if we can zoom in on that to see the tendons, but so this one on the lateral side, go ahead and relax. You can just feel back there, even if they're not flexed, you can still feel them. They just pop a little bit if you flex a little bit. So you have the biceps femoris. So it's gonna be the big one here on the outside. It's gonna come down, it's gonna attach at your fibular head, which is here on the lateral side. And all of the hamstring muscles are gonna originate at that ischial tuberosity. So remember, that's that gluteal fold, and you push up in there and you can feel it. So it has 2 heads. because its name's bicep, right? So it's there, and then at that lateral lip of the linea aspera, right? So it's at those two spots, comes down to the lateral side. And then here on the medial side, you have your semimembranosus and semitendinosus. They're both originating here at the ischial tuberosity. They're coming down, so the membranosus is coming down to that posterior surface of the tibia, and then the tendinosus is coming around to the pes anserinus. So that's our three things that attach there, right? Because we have the gracilis, the sartorius, and now the semitendinosus is coming around there as well. So all three of those are the hamstring muscles right there. All right, so our last group that we're gonna look at, and we're just gonna look at a couple of the muscles here. If you look in the book that we use, then there's gonna be several more, but we're just gonna look at a couple of the gluteal group muscles. So there's the big one, right? So that's the gluteus maximus. So it sits right here, kind of covers most everything up here on the posterior side. It's got a big origin, right? It's running along the edge of the sacrum, even down to the coccyx a little bit, and it's kind of covering this whole area. And it's coming out to that greater trochanter. So remember, we roll back and forth to kind of feel where that's attaching. So our next muscle is the gluteus medius. So to find that, you get to that iliac crest, and you drop just below it, so right there. And that's about the only spot you're gonna palpate it, because remember that gluteus maximus is covering the rest of it. So it's just that kind of posterior side of that right at that top of that gluteal surface. It's also gonna come down and attach at that, like around that greater trochanter. Now we have a gluteus minimus. It's gonna sit in there. We're not gonna palpate that one. We can kind of palpate the area if we just kind of push through the gluteus maximus, but it's gonna be hard to discern that from anything else, right? So it's underneath there as well. Now the next one that we can actually find if we want to palpate it is the piriformis and the quadratus femoris. So the piriformis, if you can see, I'm externally rotating here. So what that's going to do is make it tight, and I can feel in here. And on a lot of people, it's a little uncomfortable because it gets tight. So it's right in there. So it's running just kind of this area here, and like I said, externally rotating kind of makes it tight, so we can feel that. Now you can get too low and you get to that quadratus femoris, which is going to be right down here. So that's how you're going to get to those two. And that's about all that we're going to be able to get to on that posterior side and really make a difference, right? You have lots of other little rotators in there, but honestly, you have trouble palpating those and feeling the difference between those and those bigger muscles that are covering them up.